Hello, this is Laura Packard, and welcome to Care Talk, where we'll be answering your healthcare questions. And also, today we have a special guest to talk about COVID-19 and the holidays. So, just as a refresher, we cover a bunch of different aspects of our healthcare system, including Medicare, the Affordable Care Act, Medicaid, and more. So, regardless of what your health insurance question is about, we will try to answer it. And if you ask today, we will probably get to you next week. So, welcome to our guest today, Aleka from Health Sherpa. Can you tell us more about the key deadlines for the Affordable Care Act and getting insured for next year?
Absolutely, Laura. The great news is that in every state, there is still time to enroll in coverage for 2022. The final deadline to enroll in most states is January 15th or even later. In some cases, you can still pick a plan that'll kick in on January 1st. In most cases, your plan might now kick in on February 1st. The one big exception is Idaho, where the final deadline to enroll in any coverage for next year is December 22nd. So if you're in Idaho, make sure you don't miss that deadline. As you can tell, the exact date can vary a little bit depending on what your state you're in. So it's always a good idea to double check the exact deadline in your state.
Great. And what should people be doing now if they need health insurance?
The main thing is if you don't currently have health insurance, take 5 minutes, see what you're eligible for. At Health Sherpa, speaking for ourselves, we've enrolled more than 2.5 million people so far this year, and most of them are paying less than $25 a month. So even if in previous years you haven't qualified for assistance, go take those 5 minutes, see what you're eligible for. Sorry, go ahead. I was just going to say, if you already have a marketplace plan and you haven't gone back and seen what you have available for 2022, it is really important to know that plans and prices change every year. So your current plan might be a little bit more expensive than it has in the past. So again, even if you're currently enrolled in a marketplace plan, go check what options are available this year, see what those plans and prices look like. You could really save a lot of money by checking your options and perhaps changing to a new plan.
Great. And Aleka, if people need help figuring out the best plan for them, what should they be doing? How can they get free help?
Well, there's lots and lots of help available. You can give us a call at Health Sherpa. You can reach out to healthcare.gov. Go to the website, of course. You can also work with a trusted broker or a local navigator group. And I think we have lots of information on the site about that as well.
Yes, so go to act.tv/care talk, and we have a lot more resources for you. And Diane from Just Care and Social Security Works, if somebody has questions about Medicare and maybe switching plans, or they just recently became eligible, where can they go for more help?
Well, great question. The annual open enrollment period is closed for Medicare, but between January and March, if you've signed up for a Medicare Advantage plan, you do have the ability to disenroll and switch plans. So there's still opportunity for those folks enrolled in Medicare Advantage. You can get free help guiding you to a plan that makes the most sense for you from your state health insurance assistance program. That's sometimes called your SHIP, State Health Insurance Assistance Program. And there are volunteers and paid staff there, independent, unbiased, who can help you choose a plan. And you can go online, again, to the Care Talk website and find the number and website for your local SHIP.
Great. And our first question comes from Macomb County, Michigan. Does Medicare pay for the shingles shots? Diane?
Okay, great question. Medicare pays for a slew of preventive care services, and at some point we should talk through all of them. But for right now, yes, Medicare does pay for the shingles shot. It's really important to get it. In fact, the CDC recommends that everybody 60 and over get a shingles vaccine. Medicare covers it, though, under Part D, under its prescription drug benefit. And so your Part D plan can advise you on the lowest cost way to get that shingles vaccine. So be sure to contact them so you minimize the cost of getting it.
Great. And Aleka, what about somebody on the Affordable Care Act? Does that cover the shingles shot?
Yes, ACA plans are also required to cover many recommended immunizations, including shingles. So again, to Diane's point, there are so many preventive care services that the ACA plans cover at no cost, even before you've met the deductible. So we can maybe talk about more of those at another time, but lots available even before you've met your deductible for the year.
Great. And our next question is from Joyce about the Medicare Advantage plan. She has it for nearly 12 years and loves it. She had a back surgery and hip replacement surgery, and insurance paid for that. So she says, know your policy and what it will and will not pay, and that SHIP can help you understand it completely so you have no surprises. And Medicare Advantage policy might not be for everyone, but it's been good for her. Diane, what do you have to say about that?
Well, I would have to say this. It's so great that you have a good Medicare Advantage plan. But unfortunately, you can't know ahead of time when you're choosing a plan whether that plan is going to cover the care you need at a price you can afford. And lots of people who sign up for Medicare Advantage plans end up picking plans that deny their care inappropriately, that circumvent their treating physician's opinion about the care they need, that charge a lot in copays, that create lots of administrative hurdles and barriers to care. Usually it's people with costly conditions that have the greatest problems and who end up wanting to leave their Medicare Advantage plan. But I don't think it is possible to know ahead of time whether the plan that you choose is going to cover the care you need when you need it at a price you can afford. And that's just because each plan has its own rules about what is medically necessary care. And those are proprietary, meaning that they don't have to share those. And they're often very different from what traditional Medicare, the government administered program for Medicare, covers. So for example, after a hip replacement, traditional Medicare might cover 15 visits so that you can walk better. But if you're in a Medicare Advantage plan, it may be that they'll only cover 5 visits. And those are the kinds of issues that you can't know ahead of time, unfortunately.
Okay, so you would just say be careful and read the fine print and maybe talk to other people with that policy and see if they're happy.
I think that last point, talking to other people if they're happy, and maybe even talking to your doctor about whether the doctor feels that he or she is able to provide the care that patients need. But unfortunately, the fine print isn't going to tell you anything.
And our next question is from Josh. He says, even though universal health care is supported by the majority of United States citizens, and the US is the only developed country that doesn't have universal health care, it's currently not law. Why do you think this is, Diane? Why don't we have universal health care?
I think increasingly what we're seeing is that the corporate power of players in the healthcare industry is so enormous. There's so much money and so much ability to influence members of Congress and the White House that we can't seem to move the needle, even on some of the most, horrifying aspects of the healthcare system. So, for example, for 30 plus years, we've been trying to get Congress to negotiate drug prices. This is something that's pretty fundamental. It's what allows people to be able to afford drugs in other countries, regulated drug prices, whereas in this country, we don't have that. And the market means allowing drug companies to set their own prices, and Congress allows it. So unfortunately, I think the answer is that the powerful healthcare industries, be it the pharmaceutical industry, the hospital industry, the durable medical equipment industry, medical device industry, they all have so much power and influence over Congress that it's very hard to affect change and get everybody guaranteed affordable health care, which is what, of course, we all need.
Mm-hmm. And our special guest, Justin Lowenthal of Doctors for America and Doctors in Politics. Did you want to weigh in on this too?
Yeah, I'd be happy to. I agree completely with what Diane just said. I'll just add that from a historical perspective, um, the US got to where it is partially because we framed healthcare and health coverage as an employment benefit. Because of wage stagnation and labor stagnation, ended up tying insurance coverage to employment. And I think that became so entrenched and so tied to the labor force and the job market and just the economy that it's very, very hard to disentangle. Um, Ultimately, as people philosophically see health coverage as a benefit and not as a human right, and a benefit that's tied to their work, and so it's something that is so critical that they cannot move to a new job or take a risk of opening a small business. Um, I think it's so entrenched in both policymakers and people's minds that that's just how we conceive of health coverage and access in America, that it's just a very, very hard thing to change.
Mm-hmm. And welcome, Justin. Thanks for joining us today. And we asked you on specifically to talk more about COVID and the holidays, since so many of us are traveling or will be traveling, are with family that maybe we haven't seen in a couple years. And, you know, some of us are immune compromised and some of us maybe are seniors. And so tell us what's going on with COVID and what we need to know to protect ourselves.
Absolutely. And I'm welcome any and all questions the other panelists have today. Without burying the lead, I would just like to say first that the most important steps that you can take this holiday season are to get your booster shot. If you have not already gotten a booster shot, especially if your first dose of the vaccine was a Johnson & Johnson vaccine, getting that second dose of a vaccine is even more critical. But now with the Omicron variant quickly spreading across the world and definitely in the United States, we're finding that even more so than before, when we approved booster shots for the general public out of concern for the Delta variant, even more so now with Omicron, getting a booster shot, even if you've gotten both doses of Pfizer or Moderna, is critical. So first and foremost, getting that booster shot. Also getting your flu shot, your influenza shot. And then in terms of what to do this holiday season, I think holiday gatherings with family and friends, particularly given the last 2.5 years, are so critical to my mental health, to our family and friends' collective well-being, that I think there's no reasonable guidance to say that folks should cancel travel or holiday gatherings just because of the Omicron variant, for example. But there are steps that you can take to protect yourself and protect your loved ones. I think in terms of before traveling, limiting the amount of sort of optional social gatherings, indoor gatherings at places like restaurants, movie theaters, bars, limiting those and trying to keep your sort of social circle to a minimum, especially in the week or two before traveling. I realize it's December 20th now, so for at least the next few days. I think also before leaving, consider getting yourself tested, particularly if you can access a rapid antigen test that are available unevenly throughout the United States. It is getting better, but I know it is very, very difficult for some people to access or afford those tests. But there are tests that are becoming increasingly available at big box stores, Costco, at Walmart, as well as pharmacies. And so having several of those tests at home for you and your family to take before traveling, or to take, obviously, if you have some symptoms, I think is a great step. Traveling, if you're traveling by plane or train and want to increase your protection, I think upgrading your mask from a simple cloth mask to a surgical mask or an N95 or KN95 mask is a reasonable step to take. And we can talk more about the nuances of masking if that's of interest to people. But I think the first thing to remember is that planes and trains are well ventilated and filtered interior spaces. They're no more dangerous than most other interior spaces might be. And so what's most critical to you is having that booster shot protection, and then having a good mask to protect yourself and protect those around you in case you're asymptomatically carrying one of the variants. And then the last thing is once you get to wherever you're traveling to, taking steps to reduce everyone's risk, making sure everyone at those gatherings has their booster shot and has their flu shot, and if they don't, encouraging them to get it, making sure that especially if there are children there, that all of the adults are boosted, and if the children who are eligible get those vaccines as well. And then increasing the ventilation in those spaces and the protection in those spaces to the extent possible. This is midwinter, so the vast majority of the country is not going to feel terribly comfortable moving their Christmas celebrations outdoors, but cracking windows and potentially, if possible, purchasing HEPA filtration units for the home, especially if you're hosting one of those gatherings, really staging your house to protect the most vulnerable person in your family, I think is the most reasonable step to take. The last thing I want to say, and then I'd love to open it up to questions. There's a lot of information out there about the Omicron variant, what it is, what it means for all of us. I think there's a couple things to understand. The Omicron variant is, just like Delta and some of the others before it, an evolution of the original SARS-CoV-2 virus. This Omicron variant is unique because it has more than 30 to 40 consequential genetic mutations that make it a little bit different in terms of how it infects cells in the human body and what it might do to cause illness and what it might do to transmit to other people. What we have seen with this variant is that it is more transmissible and it moves more rapidly. So it for every person it infects, that person is likely to infect 3 to 3.5 other people, even if they are vaccinated. And this is in some real world data that we're just now getting and just now understanding. But that is a number that is much higher than we've seen even with the Delta variant. There are some reports, or were some reports initially from South Africa, that it was less likely to cause severe illness in those that it infects. But an important caveat there is that the people who were studied for that data were generally young, healthy, vaccinated people. So this idea that it's less potentially serious or less deadly may not apply to a lot of the public in the United States, those who are either unvaccinated or around unvaccinated people because of their work or because of their families. Those who are older, those who are immunocompromised, that may not apply the same way. In terms of catching the virus, the general sort of rule of thumb is that if you, what you thought of as being fully vaccinated, quote unquote, 2 months ago for Delta, having 2 shots of Pfizer or Moderna, for example, you can think of Omicron as sort of removing one of those doses or one of those barriers. And this is why we are sort of encouraging boosters so much more now with the Omicron variant. We do find that Omicron is much better at evading the immune system, even if you're vaccinated with Pfizer or Moderna, but the booster really boosts, as the name suggests, your protection. The good news, however, is that it does seem to have more trouble causing severe disease in most people. And that's as a result, I think, of the vaccines. And that makes sense from an evolutionary perspective, that a virus would want to be more infectious and replicate itself, reproduce itself more and more, but not cause such severe illness that the host that it infects gets sick and even potentially dies. So I think what we're most worried about with Omicron is its potential to basically break an already overwhelmed healthcare system. And we're seeing some evidence of that happening already post-Thanksgiving. And we're really worried about its potential to do that after the holidays, mostly because even if it is causing less severe illness proportionally, it may infect so many more people that will still have a huge spike in hospitalizations. And hospitals are already facing staff and funding shortages, staff attrition and burnout. And I think it behooves all of us to protect ourselves, protect our loved ones, and also protect our communities and our healthcare systems as much as we possibly can. So I'll stop there. I would love to take questions from you guys.
Well, Aleka, you had a question about rapid testing.
I do. So, Justin, thank you for all this great information. One question I have is, I'm, visiting family for the holidays, as many of us are. I was lucky enough to get a big stash of rapid tests before I came out. What's your best advice on how to use rapid tests, how to interpret them? I've heard people say if you test positive, you're infectious, and maybe if you're negative, you might still be infected, but not able to spread it. So, would love to hear your take on that.
Yeah, so rapid tests. So just stepping back, there's basically two types of tests, or two buckets of tests that we think about. These rapid tests are what are known as antigen tests. They're actually looking for the protein that's on the surface of the virus, the spike protein, for example. And because of that, they are very, very good at detecting the presence of that protein, but sometimes can detect falsely come up positive because they're detecting something that may look like that protein, but is actually a different virus or something else entirely. And they can come up negative, particularly if you've only very recently become infected, or if you've been infected sort of so long ago that even if you were asymptomatic the entire time, you're just so far out from your infection that it is no longer there's no longer enough of that protein around. The other type of test, the one that's used in hospitals and by doctors' offices, is called a PCR test, and that detects the genetic information in the virus. That is much more sensitive at picking up any infection at all, regardless of where in the cycle that virus is. In terms of interpreting them, I would say, and using them, I would say that it is a really great idea to test yourself before seeing loved ones. I think the closer you can test yourself to the time when you're seeing loved ones, the better. So if you don't have any symptoms, you're not worried about having been infected by a close contact, and you can test yourself within a day or two, or even within a few hours of going to a family gathering, and that test comes up negative, you should feel pretty good. You should feel pretty confident that you're either you don't have SARS-CoV-2 infection, or if you do, it's at such a low level that you're not a risk to transmit it to other people, particularly if everyone around you is also boosted and vaccinated. So I think that's one potential use of those antigen tests. Obviously, there's false positives and false negatives to worry about there. But again, if you don't have a close contact and you're not having any symptoms, you can feel pretty good. I think if you're using it to determine whether you've been infected by somebody around you who has already tested positive, then you have to think a little bit more about when to take that test. So the guidance with the previous variants has been, if you know you were exposed either by a household contact or somebody locally, you were told by contact tracers, or they told you, waiting 4 or 5 days for that incubation period to really take hold before testing yourself is pretty critical, because if you test too early, even if you were exposed and infected, the level of those proteins in your body may not cause the test to become positive. So really waiting 4 or 5 days is helpful to feel more confident. We're seeing with Omicron that interval might be shorter, because Omicron's what's called incubation period might be shorter. So that may be even 2 or 3 days with the Omicron variant. But it's something to keep in mind if you're using it in that way.
Okay. And Diane, you had some questions about masks and masking.
Yes. I just wanted to piggyback a little bit off of Aleka's question, though, and Justin's answer in terms of waiting if you think you've been exposed, because I guess the question would then be, if you wait and you're around loved ones, you haven't tested, but you've just been exposed, that could pose a serious risk. So I just want to follow up on that and ask a second question, which is, I've been told that it's good to take 2 rapid tests within 24 hours of each other, just to make sure to sort of double check on that. So I'd love your thoughts on that. And then with masks, the question I would have is sort of how important it is to wear a K95 or an N95 mask versus like a bandana. And especially if you're indoors, you've tested negative to your rapid test, but now you're with family, should you be wearing masks indoors with family, even if you test negative? You mentioned having a lot of ventilation? Should the windows be open? If, that kind of question. Then finally, last question has to do with if you've taken the Johnson & Johnson test, we've been hearing that it's not as effective as the Pfizer and the Moderna tests. And I just wondered your thoughts on whether when people are getting second or third tests, they should be switching over to Moderna or Pfizer.
Sure. So I think with regards to the first question about what to do while you're waiting to be tested, I think the guidance generally is if you're told or if you find out from a family member, a friend, a colleague, or from a contact tracer or a public health organization that you've potentially been exposed, they will give you guidance on what to do. They may require you or guide you to take these sort of more official tests, in which case just following that guidance, if it's from a public agency, is what you need to do, and not sort of overthink the at-home tests. But if it is like a family member or friend who's informally told you and you know when you were exposed to them, I think what makes the most sense is just to stay home, try to isolate yourself as much as possible, and basically self-quarantine for that 3, 4, 5 day period, and then take that rapid test and see, and potentially take 2 tests, and I'll get to that in a second, but take that rapid test, see if it comes up positive or negative, and then go from there with confirming via a more official test or with self-isolating and monitoring for symptoms. In terms of 2 tests, in the testing world, like I said, if you're using it basically to screen yourself and you don't have symptoms, you don't know of any contacts, and that test comes up negative, I think a single test can make you reasonably confident. But taking 2 tests is a reasonable step. And obviously, if they both come up negative, that gives you even more confidence. In terms of the exact numbers on that, it varies a little bit test by test. But if you're using it for screening, I think just that single test is perfectly fine and reasonable and more affordable for a lot of people. In terms of masks, so I think it depends on the setting. I think in general, the more people can be using upgraded masks like a surgical mask as opposed to a cloth mask, or a cloth mask more so than a bandana, I think it's sort of in that order of hierarchy. So I think a cloth mask that fits a little bit tighter around your face and has a little bit more cloth material gives you more protection than a bandana would and gives people around you more protection. Surgical masks are obviously designed more so for viral protection. And so I think in general, when you can use surgical style masks out in public for gatherings with family, to the extent possible, or when grocery shopping and those sorts of things, that's a reasonable thing to do. I think N95s and KN95s, they seal more tightly to the face and so are better protection, but also for that reason, a little bit less comfortable to wear on a regular basis. And so using them while traveling, for example, on an airplane or in a very, visiting a very tight-knit sort of indoor social area. And potentially, double masking with surgical and a cloth mask, if that's something that you prefer to do. I think those are all really good steps to keep in mind. I think when you're with family, any additional step is helpful. I think distance is obviously helpful, but is sometimes difficult with family and indoors. I think more ventilation, either with windows or with filtration units, is great. And I think if you can keep your mask on, especially if you're in close contact or when not eating or drinking, for example, I think that's helpful. But these are all just sort of added steps. And I think if everyone's vaccinated and boosted, that's not a perfect protection, particularly against the Omicron variant, but it does help substantially. And then the last question about the Johnson & Johnson vaccine, it is critical that people get a second dose of something if they got that first Johnson & Johnson dose. If it were me, based on the data I've seen, I would switch to getting an mRNA dose like a Pfizer and Moderna rather than a second Johnson & Johnson dose, particularly with the initial data about the Omicron variant. We have found that Johnson & Johnson provides a lot less protection than even 2 doses of Pfizer and Moderna do. And given that it is approved by the CDC and by the FDA to switch, mix and match, I think seeking out an mRNA vaccine like Pfizer or Moderna is probably your best bet.
Thanks. And so where would you say you should get masks? Can I just order some on Amazon or buy a pack at the grocery store? Or, should we be concerned about fake N95s still? How do we know that they're any good?
Yeah, so I think something to keep in mind is that most sort of big box stores like a Walmart or a Costco or a CVS are not generally selling um, uh, non-authenticated or potentially fake masks on if they were to become aware of that, or the public were to become aware of that, that would be, I think, really problematic for those companies. So you can generally trust those sort of surgical style masks, which is what they generally tend to sell. For N95s and KN95s, I think the bigger websites like an Amazon have a pretty robust sort of reporting mechanism for sellers who are potentially peddling fake masks. So you can trust those bigger websites a little bit more than if you were to go to a less known or overseas or smaller store. But I also think, you're looking for those brand names, particularly for the N95 masks, looking for those brand names like a 3M, like a DuPont, those sorts of things, because they're the main manufacturers of those masks. And so as long as the packaging and the material, the stamps and the material are similar to what you're would expect from those companies, you can feel pretty confident. But like I said, really good surgical masks, upgrading from a cloth to a surgical style mask, I think is probably the most important single step in the masking arena that people can take.
Mm-hmm. And how can you reuse masks? Can you reuse masks?
Yeah, so I think this comes up most frequently with the N95s and KN95s. We were reusing them at the beginning of the pandemic because of shortages, and I think the shortage is a little bit less critical of an issue now, at least for masks. There are other supply chain issues that I'm sure have been covered either on this show or elsewhere. But with masks, we're a little less worried about it. I think with the N95s, people are generally using them for shorter periods of time, like air travel. And so as long as it's not deformed, it's still fitting your face snugly. It's not soiled because you've really, sweat through it or that sort of thing. Reusing it in its original form is perfectly fine. There are some methods that have been studied for sort of disinfecting masks, and I won't go into that science. But I think you can use N95 several times, and we do in the hospital. Surgical masks, I also tend to reuse more out of convenience. And again, same things. If I can feel like they're sealing tightly to the bridge of my nose and around my cheeks and chin, and are not intolerable to wear because they're deformed or because of having been soiled in some way, I think reusing them is fine. But again, those shortages are less critical. And so I think as long as you can get the supply that you need, I would just use what you have and exert reasonable common sense in sort of reusing them.
Mm-hmm. And I would also just make a shout out now for everybody. Many states are plugged into the national system for COVID alerts. So when I was traveling, I was in Nevada and I was exposed, and I got that alert when I was back in Colorado. So it does work across state lines. Not all states are opted in, but it is free. If you have a smartphone, you can go into the settings and opt yourself in, and then you will get notified if you are exposed to somebody. If you've spent however many minutes the app detects, and then that person has to report that they have COVID and send it into the system. But that does work across state lines, and especially if you're traveling, you should opt in before you go, because it's good information to have to know if you've been exposed, and you probably should get tested. Are there other things, Justin, we should be thinking about before traveling?
I think we've covered most of it. I do like the suggestion about sort of those Bluetooth-based smartphone trackers. I will say, though, that things like contact tracing and self-reporting are very variable state to state. And obviously, if people have their own rapid tests, one of the downsides to that is that there's no centralized reporting of positive rapid tests that people are doing at home. So the contact tracing is only going to be as good as what that reporting is like and the load that these contact tracers are facing. And so one of the big concerns with the Omicron variant is that even if it is less severe than other variants in terms of the disease it causes, if it causes so many cases, to rapidly expand across the country, it's just going to be beyond the efforts of contact tracers to be able to keep up with that. And so I think really thinking critically about using those rapid tests, both before getting on an airplane and then maybe in the half day or so before, an actual family get together. I think, again, upgrading those masks, but also, having conversations with your family to really make sure that everyone there is vaccinated and boosted, who is eligible to be so boosted, making sure everyone has gotten their flu vaccine and having conversations with those who haven't, and really identifying the person who's or people who are most vulnerable among your family, either the elderly or people with immune compromise of various kinds, and thinking, about how we can protect them the best we can, whether that's through how we're designing our gatherings or improved ventilation. And just following up as well, if anyone has symptoms coming out of one of those gatherings, testing yourself at home and trying to isolate to the extent possible until you can test, letting family and friends know, letting those contact tracers, those public health agencies know, and just being a good citizen and a good community member. I think one of the things that has been, I think, most demoralizing to a lot of people in healthcare during this pandemic is how low the sort of communitarian ethic has been among sort of this sharing of risk and sharing of information. And so to the extent we can all be good citizens in that regard, I think it would be really great to see us kind of step up and do that.
Thanks. And if people have more questions, where do you suggest people go to get their questions about COVID answered? Just to keep reading the news, go to the CDC's website?
So I think for sort of the official line on things like booster eligibility, on things like current guidelines on isolation and incubation periods of viruses, testing, et cetera, the CDC and the FDA's websites are very helpful. I think there have been some news agencies who've done an incredibly good job of covering the science and really distilling it, and also the current guidance. In particular, I follow the New York Times coverage, as well as the Atlantic. Catherine Wu and Ed Yong have done incredible reporting and incredible writing, and so I read basically everything they do. They put out, and would encourage others to do so as well. And then there's a lot of really good organizations, including one of the ones I'm representing today, Doctors for America, but others as well, have put out really helpful and really well updated question and answer sort of guides, resources and graphics about how to identify sources of misinformation online, for example, or where to go with special cases. For example, if you live in an immigrant community and you're worried about international travel, or for those who are worried about getting their rapid tests reimbursed by insurance, those very more particular questions, a lot of organizations like DFA, like NRC RIM, and I can provide this these websites for follow-up, as well as several immunization, Vaccinate Your Family and other immunization advocacy organizations have really, really great websites, TikToks, video clips, things like that are really worth following. So happy to send a resource guide to distribute to anyone who's interested.
Well, thank you so much. And we just had a question come in via text, and I'll ask it because I also care about this question. This person has had both shots and a booster. They got the booster at the end of July, so it's 5 months ago. So does anybody know anything yet about whether there is going to be another booster? Or, what do you do when you get to the 6-month period after your booster? Because I got my booster in August.
Yeah, so it's a good question. I think we don't have great data yet on long-term outcomes after a third dose, it's actually, from a scientific standpoint, we don't refer to them as boosters in the same way we think about booster shots of like a tetanus shot, for example, just because of this shorter interval between the second dose and the third dose. But for those who've gotten a third dose, we have the data on how Delta and Omicron how they perform in the short term over the the 6 months we've studied so far, and our protection looks quite good against Delta and even against Omicron with a booster. There has been talks, depending on how variants continue to evolve, about new boosters being needed for better coverage of future variants, or even endemic or seasonal cyclical sort of variants of the disease, or of the virus, I should say. But we're not at a point yet where we have those anywhere near prime time, and I think it's also really, really premature to talk about a second booster, and really not a good rationale for anyone pursuing a second booster, just because it's just been such a short time interval. And what probably is most critical, we got this third dose because it seems like antibody levels are waning after the second dose, but the first and second doses were so close together that a lot of scientists are saying what may have been better is to spread apart those first and second doses more. And now that the third dose was so far out from the second dose, our protection may be much longer lasting this time around. And so I guess the long and short of it is to stay tuned, but for now, get your booster, get your families boosted, and feel pretty confident that you've done what you can in addition to these other public health measures to protect yourself.
Well, thank you so much for joining us today. And thank you, all of our panelists. And we will be back next week for Care Talk to keep answering your healthcare questions. Thanks.